Good day. I want to welcome you to the University of South Carolina Arnold School of Public Health. We are one of 106 accredited schools of public health across the U.S. You may see a lot of public health programs at different colleges, but you need to be sure you're focusing on a university or college that is an accredited program, and USC is one of those 106 schools around the country that are accredited. We are number 6 in the number of PhDs we grant, only falling behind schools like the Harvard School of Public Health, Johns Hopkins, UCLA, University of Michigan, and major institutions such as that. So we're number 6. We're also number 8 in NIH funding around the U.S. as well. So we're a highly prestigious School of Public Health. And today I want to talk with you a little bit about the Department of Environmental Health Sciences. My name is Dr. Geoff Scott. I'm chair of the Department of Environmental Health Sciences, and I want to basically introduce you a little bit to our department. Our mission in our department is to understand how environmental exposures affect human and ecosystem health and disease, and how these activities interact and affect with the environment. The diversity and collegiality of the research and faculty within our department makes us really uniquely poised, as well as to provide outstanding research, but also advanced education and training on the interactions of environmental and human health, specifically within the areas of microbiology, toxicology, nanomaterial science, and exposure science, community engagement, and environmental justice issues. So what is environmental health sciences? It is a science that basically integrates looking at the environment, because man is a key player in the environment, both as a steward of natural resources, also maintaining environmental quality conditions that are conducive to good public health. Basically that involves field work, it involves lab work, it involves developing new and novel concepts and technologies to assess the health of the environment and how the health of that environment affects us as people. One of my good colleagues, Dr. Lou Gillette, I think put it best. And Dr. Lou Gillette was a world-class renowned expert on endocrine disrupting chemicals. And he used the novelty of how reptiles can be used to predict whether or not a chemical is an endocrine disruptor. And he said, being an environmental health scientist, it's the 4 best jobs on the earth. You're an environmental detective, an adventurer, an artist, and a storyteller. I would like real quickly to talk about the degree programs within the Department of Environmental Health Science. We offer a Master's in Public Health, our MPH degree, a Master's of Science, and a Doctor of Philosophy. Our areas of research concentration, as I said earlier, are environmental microbiology, environmental toxicology, nanomaterial science, oceans and human health, and eco-forecasting, that is developing health forecasts that protect the public, and then community engagement and environmental justice in our outreach to the public. We have 2 research centers, our SmartState Center on Nanomaterial Science and our NIEHS Center for Oceans and Human Health, one of 4 national NIH centers. Today we're specifically focusing on our Masters in Public Health program, our MPH program. So as I talk a little bit about our MPH program, one of the things I want to make sure is that you understand coming into our department means you're walking into a research network of strategic partners. These include strategic partners in the federal government. It also, such as NOAA, EPA, U.S. Geological Survey, the National Park Service, the Department of Energy, Savannah River National Lab, and the South Carolina Department of Health and Environmental Control, one of our big state partners. It also includes strategic alliances with private industry such as Lockheed Martin. A number of our graduates have gone on to work there. And then looking at academic institutions within the university, the School of Medicine, the College of Engineering, the College of Arts and Sciences, as well as other academic institutions, including places like Baylor University, University of Maryland, College of Charleston, the Citadel, Rutgers, and marine labs like the Mote Marine Lab. We also work with a lot of non-government organizations, the Low Country Alliance for Model Communities, Water Watch, which is a lake association at Lake Wateree, Socorro, which is the Southeast Coastal Ocean Observing Research Network, and also the Interstate Shellfish Sanitation Program, which is the tripartite federal agency that regulates molluscan seafood safety. We have international collaborations throughout the world, including China, Europe, and Australia. These opportunities with our partners provide you with opportunities to do world-class research. I want to talk a little bit about our faculty. We have 9 tenured track faculty and about 4 adjunct faculty within our department. Our areas of research include air pollution, bioinformatics, environmental microbiology, toxicology, sustainable farming. It also includes research with marine mammals and using them as sentinels of health, and also human toxicology. I am the chair of the department. Our graduate director, who you'll hear from in just a minute, is Dr. Dwayne Porter. Dr. Kelly Fleming is our undergraduate program director, and then our MPH program director is Dr. Daniel Kilpatrick. And since we're talking about our MPH program today, I'm going to let Dr. Kilpatrick say a few words now about our MPH program. So welcome, and Daniel.
Thank you, Dr. Scott. Well, as Dr. Scott shared, I'm Daniel Kilpatrick, and one of the newest faculty members here in the Department of Environmental Health Sciences and the MPH program coordinator. And as that coordinator for our Masters of Public Health program in ENHS, my main philosophy is having an open door policy. So one of the great opportunities for our students are opportunities for practice. And so enabling students and coordinating their practice opportunities is something that I'm very forward and thinking about and excited about, giving students real-world opportunities to apply what they've learned and then to see the needle move, especially with things like where my area of expertise is in community engagement and emergency preparedness come together. So as Dr. Scott mentioned, we'll have Dr. Dwayne Porter share about some of the degree requirements with the MPH program, and one of those especially being their practice experience, as well as the core coursework that's required for that, in addition to a menagerie of potential electives that students can take, both in the Arnold School, in our department, as well as other schools around the university. So with that, Dr. Scott, I'll turn it back to you, and go ahead.
And I will wrap our introduction up here with just saying, as you look at other schools in public health, ask yourself a question. Are they teaching their classes using a transdisciplinary science curriculum? Traditional public health is taught with basic courses like environmental health science, epidemiology, biostatistics. They're all taught in silos where the courses are not integrated. If you come to our program, you will find that you will be in class with epidemiologists, biostatisticians, and environmental health sciences, integrating the world public health issues, describing those impacts, then coordinating that with health assessments in epidemiology, and then the statistics that underpin and tie all that research and science together. This training will give you the training you need to be a world-class public health researcher and also scientist. So with that, I'll conclude our welcome, and we really are glad to have you with us here today.
So we want to take the opportunity now to transition to an overview of the MPH program provided by Dr. Dwayne Porter.
Good afternoon. My name is Dwayne Porter, and I am the graduate director for the Department of Environmental Health Sciences in our Arnold School of Public Health. And I'd like to take a minute or two to introduce you to our Master of Public Health, or MPH, graduate degree. The MPH degree is an applied graduate degree in public health, and it prepares our students for successful entry into the world as a public health practitioner. It is a degree that has a bit of a prescribed curriculum in that all of our students are leaving the program with a firm grasp of the foundational knowledge of public health as represented by the core competencies of our accrediting body. The program also provides the flexibility for a student to develop a program of study that is consistent with the professional goals of the student. We tailor the program of study with each and every student to ensure that we are providing the student the highest quality of education possible. Being in a school of public health, we focus on community-based research and research-based education, and a core component of the MPH program is the practicum or externship or internship or integrated learning experience, any number of terms that describe and define the opportunity for our students to take the knowledge they've learned from the classrooms and put it to use in an applied practical experience. The program requires a minimum of 42 hours post-baccalaureate, of which 6 are associated with the applied practice experience. We place our students in any number of professional settings, ranging from federal and state agencies to local municipalities to nonprofits to other organizations that are engaged in the practice of public health. As you consider your opportunities for graduate education, we would love for you to consider not only our MPH program, but all the programs associated with our Arnold School of Public Health. If you have any additional questions or would like to just talk about our school, our department, our programs, please feel free to reach out to me at the information provided below. Take care.
Now we're going to talk a little bit about our Oceans and Human Health Center here at the University of South Carolina. It is an NIEHS funded center for oceans and human health and climate change interaction. Our focus of research in our center is specifically not on the direct effects of things like temperature or salinity, changes in pH, flooding that come with climate change, but rather the interaction of when those factors and stressors interact with the environment, how do they cause major changes. The 3 stressors that we are looking at are Vibrio bacteria, harmful algal blooms, and microplastics. And our research is highly focused in understanding how climate change enhances the virulence of Vibrio bacteria, as we have seen an increase from 8,000 to 80,000 cases of Vibrio illness in the U.S. over the last 10 years. Similarly, how increased nitrogen and phosphorus and eutrophication enhances the toxin production of harmful algae in lakes, waterways, and in drinking water, and the new stressors that people are exposed to through contact recreation, drinking water, and seafood consumption. And then we're finding that microplastics interact with both of these stressors to enhance exposure to people to both Vibrio bacteria and HAB toxins. So our research in oceans and human health is focused on prevention, as all public health is, serving out forecasts that warn the public when they may encounter toxic algae or where they may encounter Vibrio bacteria that are highly virulent and may cause death. So our center is highly focused and focuses on community engagement and interactions to warn the public, particularly in environmental justice areas.
So next we'll transition, after having heard from Dr. Scott, to Dr. Jamie Lee, the director of our SmartState Nano Research Center. Jamie?
Hello, I'm Jamie Lee. I'm director of the Center for Environmental Nanoscience and Risk at the University of South Carolina. And within the center, we are researching the implications and the applications of nanoscience and nanotechnology. So to give a bit of background about what nanoscience is, it's all based on size. And nano essentially means very, very small, and specifically 1 to 100 nanometers in size. That is 10 to the minus 7 to 10 to the minus 9 of a meter. And to give context for that, it's about 100,000 times smaller than the width of a human hair. Now, then the question is, why is that important? So nanoscience is important because at that size, particles behave differently than they do at larger or indeed smaller sizes. So they have different physical and chemical and biological behaviors and processes. And because of that, nanoscience has been used and nanotechnology has been used very, very widely in a whole range of human processes. So industrial processes, consumer products. It's used in energy production, electronics, medicine. Phones that we use are heavily reliant on nanotechnology and nanoscaled materials. And because of that, materials that are in the nanoscale are widely found in the environment. So they're discharged from these products and processes. Inevitably, they get into the environment. And they're a potential risk to us. So some of these particles can be toxic, therefore hazardous. And they're in relatively high concentrations and widely distributed in the environment. So there's a potentially wide exposure. And along with these novel properties, that gives us a potential environmental and human health risk where we don't always know why they're risky. What are the mechanisms that causes the hazard and the wide exposure in the environment? And therefore, we at the center are studying these implications of nanoscience in the environment and subsequently what that means for human health. Now, it turns out that a lot of the potential challenges and potential problems with nanoparticles are related to their physical and chemical properties, so their size, their chemical composition, their surface chemistry, and their charge and their shape. But by altering those, you can actually reduce the hazard and the risk. And similarly, when we use them, we can control their physical and chemical properties to make them more applicable, more beneficial to the processes for which we use them. And in the center, we're looking at environmental applications. And as one example, we're looking at environmental remediation and resource recovery. So we're trying to use nanoparticles and nanomaterials for metal recovery and removal from waste streams, for treatment of harmful algal blooms and treatment of oil spills. Now, putting that all together, we can then develop nanoparticles for maximum benefit, so maximum recovery of oil in an oil spill, for instance, while also making the particles in such a way that their environmental challenges are minimized and their environmental risks are minimized. So overall, what the center is trying to do is fundamental and applied research in minimization of the implications and the problems of nanoparticles and nanomaterials, while maximizing the benefits and the applications of these same nanomaterials and nanoparticles.
So I wanted to take a quick moment to share about some of the research and practice that I've been a part of here in the Department of Environmental Health Sciences. And what I want to share about is an initiative called EJ Strong. And when I mention EJ, that stands for Environmental Justice. And so what EJ Strong is it's a community engagement grant that we have with the Environmental Protection Agency to do disaster preparedness with environmental justice communities. And why this is so important and even timely is that we know with the influence of climate change that extreme events are increasing in frequency and severity, and also with things like the COVID-19 pandemic, we observed how populations like the African American population were disproportionately burdened by its effects. So more severe cases, hospitalizations, and even death. So who this initiative involves includes several faculty here at the University of South Carolina in our department, as well as individuals from South Carolina's Health and Environmental Health Department, the South Carolina Department of Environmental Control, or DHEC for short, as well as the College of Charleston, Clemson, and most importantly, our community-based organization that has partnered with us called LAMC, or the Low Country Alliance for Model Communities, which is based in North Charleston. And where we have done this work has been with several communities with environmental justice issues that participate in the project, including the Rosemont community in Charleston, as well as Lower Richland here just outside of Columbia. And these communities who we've partnered with have a host of hazards they deal with on a chronic basis, including flooding, chemical release, wildfire. In the case of Lower Richland that I just mentioned, they have the Westinghouse nuclear power plant, they have Dominion coal-fired power plant, they have a paper mill, as well as a variety of other industries in the area. So there are other probable hazards for South Carolina in addition to what I just mentioned, including hurricanes, as well as we have a fault line that runs right through the middle of our state. So earthquakes are a potential disaster too. And what we've been doing with this work in EJ Strong since the fall of 2020 and will continue until the fall of 2023, the neat thing about this effort is that it's generated significant interest from around the Southeast region, and we're anticipating another round of funding to expand our work. So how we've gone about doing disaster preparedness in EJ communities around South Carolina is twofold. So we've done training with EJ advocates around the state through several workshops where we've utilized a curriculum that was developed in the Philippines based on a United Nations model called Community Managed Disaster Risk Reduction. And this training teaches community leaders how to carry out disaster risk assessments by assessing hazards, vulnerabilities, and capacities. And then the second part of that twofold approach is that once community leaders are trained, we carry out field practicums in our very communities of interest. So the practicums are actual efforts for the community leaders to take what they've learned to do the hazard, vulnerability, and capacity assessments in their own communities. And after the assessments are completed, the communities then develop action plans with a goal statement, SMART objectives, and corresponding activities on how to reduce the disaster risks based on what was found with their assessments. So the communities go through an implementation period of their action plans and then evaluate their efforts. So I'll just share that this has been a highly rewarding experience for me, and something that is a dream job of sorts to take what I've learned internationally and apply something still highly relevant for communities here in South Carolina.
Well, you have heard from our faculty describing our program and our research and different aspects of the department, but the best testimonial in terms of how our department functions comes from our students that embody our program. And so now you're going to hear from our students who will provide a little more insight into our program.
Hi, everybody. My name is Abby Simpson, and I'm a current Environmental Health Sciences MPH student here at USC. I did my bachelor's in microbiology with a minor in biology at Clemson, and I would say that my public health journey probably started while I was still at Clemson. I had the opportunity to take a variety of public health classes, and I ultimately graduated with my public health certificate while I was there. This initial interaction with public health motivated me to explore options for grad school programs. So a little bit of background, I grew up in the Charleston area and I've always loved spending time outside. I worked as a naturalist throughout undergrad and I helped facilitate interaction and learning in other people immersed in our coastal ecosystems. It's important to me to be able to promote environmental health, healthy activity, and to spark an interest in our natural world among all people. I ended up choosing the Environmental Health Sciences MPH program here at USC because I was interested in the intersection of where my passion for public health met my love for the natural environments of our state. So the Environmental Health Sciences program does a phenomenal job of blending the aspects of upstream thinking with various environmental problems such as climate change, pollution, water quality, resource management, and of course, human health. The program has motivated me to change the way that I think of and approach environmental diseases as a whole in order to become a better caretaker for both the environment and the people that live there. So thanks, guys.
Hi everyone, my name is Beata Dewitt and I am an MPH student at the University of South Carolina Arnold School of Public Health. And today I'll be talking about my journey in the Environmental Health Science program. To start, I wanted to go over some background information about myself. I was born and raised in Columbia, South Carolina and graduated from Lower Richland High School in 2018. I went straight to Benedict College where I got my Bachelor of Science in Public Health, and now I'm at the University of South Carolina trying to earn my MPH in Public Health and Environmental Health Science. My interest of study includes One Health, which is the importance of health, animals, and the environment, preparedness and response for natural disasters and states of emergencies, community outreach, connecting and relating to the residents and public, and health equity by gaining access for all individuals for healthcare and services. So as stated before, I am an MPH candidate in the Environmental Health Science program, which includes that healthy environments and health enhance the health and well-being of individuals and the communities in which they live. Thus, the goals of the department are to develop improved methods for assessing the health and quality of the environment, promote a clear understanding of interactions between humans and their natural, home, and work environments, achieve molecular to landscape levels of resolution for understanding health-environment interactions, promote the natural resources upon which life depends, and provide scientifically sound information for policymakers to encourage social awareness of and societal actions towards sustaining a healthy relationship with the environment. I want to talk more about my fall semester at the Arnold School of Public Health. The courses that I took were quantitative and qualitative methods in public health, which was the mathematical and descriptive concepts of research, and I also took the Environmental Health Science seminar and concepts of environmental health science, where we learned about various topics such as trace metals, air pollution, and wastewater treatment plants. Events that I participated in included the Environmental Health Science seminar series, which is part of my previous class, where alumni came back and shared their journeys or just their research, from doctors to farmers, scientists, and professors, which was very informative and also talked about the impact of their work to the public health field. And also, the best part that I love about the program is the staff and facility that I work with closely, from Dr. Porter, who is the Director of Graduate Studies, to Dr. Scott and Dr. Kilpatrick, who are professors at the school, and Zach Jenkins, who is the Workforce Development Associates, who also spreads the word to students about job postings, internships, and work development opportunities. Another aspect in my journey in the Environmental Health Science program is my job at the South Carolina Department of Health and Environmental Control. I'm currently an intern in the Office of Environmental Affairs since May of 2021, and I work with the EJ Strong Group, also known for strengthening communities for disaster risk reduction, response, and recovery in South Carolina. And what we do is we work with underserved communities to focus on hazards, vulnerabilities, and capacities of their communities. We participate with them and we work on community managed disaster risk reduction training, so that way we're figuring mitigation solutions for them during disasters or emergencies. So with my job duties at the health department and my studies at the Arnold School of Public Health, I hope once I graduate, I'm able to focus on environmental justice, where all individuals live in safe environments with clean water and clear air, ecological justice, where we make sustainable decisions pertaining to natural resources and wildlife and the environment, and community outreach, which is advocating for the public's needs and allowing partnership between the community and stakeholders. And I would like to thank everybody for listening to my presentation.
Hi, my name is Lacy Barnette, and I'm a fourth-year PhD student in the Arnold School of Public Health's Environmental Health Science program. I work in our soil health lab, where I also completed my master's as a student in the School of Earth, Ocean, and Environment. While I didn't have any plans of staying and continuing on with my PhD, I'm so glad I did. I love it, and I'm so happy to be part of ENHS. My research currently focuses on science communication. However, it's spanned a broad variety of things in my time here, starting with my master's research that focused on the physical, biological, and chemical properties of soil with the addition of compost. I've also had the opportunity to be part of a project looking at the use of nanoparticles for environmental solutions. And all of that's really led me to where I am now, doing a lot of producer interviews and talking to farmers about how we get research implemented onto their land. So there are 3 particular things I'd like to highlight that I love about our department. First, I love how interdisciplinary and diverse the ENHS department is. Everything from nanoparticles in development to harmful algal blooms and the toxins related to those algae to infectious diseases. We really span a lot of topics, and there's a lot of different expertise in this department, but we all ultimately have a focus on environmental health and public health and how those interrelate. With so much diversity, I just really love the opportunity for collaboration and how much I learn from others in our department. The second thing I'd really like to highlight is the support from our department. I not only get to learn from and work with great people here in ENHS, but I've also personally felt very supported, encouraged, challenged, and valued. I get to work with people that really care about me as a student and about me as a person, and ultimately, that's played a huge role in why I stayed. And the last thing I want to highlight is the growth and engagement that I've really experienced here. In the time I've been here, I've really grown and changed as a person, and I think that has not only been supported, but really due to all of the different things that I've gotten to be a part of. I can confidently say that I have grown as a person, as a student, and as a researcher here. And as I mentioned, my research topics have really changed in my time, but so have my goals. I feel really grateful to have not only been allowed, but encouraged to grow and change and set new goals. So to end with, while this wasn't really my plan to get a PhD, I know it's exactly where I'm supposed to be. I'm excited about my research, and I'm excited about the opportunities that I'm going to have upon completing this degree. And I know that I'm a better person and a better professional from my time here and all of the opportunities that I've had to be engaged and learn from so many people.
So in closing, we would like to thank you for joining us for our podcast today on the Department of Environmental Health Sciences in the Arnold School of Public Health. As you are now completing this current journey you're on, completing your undergraduate degree, many of you may have already found the next step in your journey, but if you're still looking for that next step, we would really like to invite you to come and look at our MPH program in the Department of Environmental Health Sciences at the University of South Carolina. Dr. Kilpatrick?
Thank you, Dr. Scott. Yes, just some closing remarks here. To find our website for our program, the best way to find that is sph.sc.edu, and you can search for the Department of Environmental Health Sciences. My contact info is on there, but if you want it for quick reference, you can call my phone number at 323-301-0190. Again, 323 833-301-0190, and my email address will also be listed on there as well. And as MPH coordinator, I serve as a clearinghouse for all interests and prospective students to then pinpoint with our respective faculty and their research interests. So please don't hesitate to reach out to me if you have particular research interests with a certain scope. I'd love the opportunity to chat with you and then make connections for you around our department in the School of Public Health to hopefully play a role in this very important next part of your journey. So again, please don't hesitate to reach out to us if you have any additional questions about our program.